Good morning all. Today we'll be demonstrating the level of protection which is required while we are taking care of patients. This video is specially made for Sarvodaya hospital staff. So we have geared three level of protection: level 1, level 2 and level 3. And this is about the corona care unit. So this is the isolation ward which we have made. As you can see, it says isolation and entry restricted. So first we'll start with the hand hygiene. So our staff will first perform all the steps of hand hygiene. So then we enter inside. So we have one donning and doffing area. So you go to the donning area. The linen room has been converted into the donning area. So once you are inside, first of all we'll start with the level 1. So you start by wearing your you start by wearing your gown. So there are two type of gowns which are available. So this is one cotton gown which is used, or else you can use this blue gown, surgical gown, which is also available with us. Either of them you can don. Clean gowns. You don't need actually sterile ones, you just need clean ones. After gown, you need to put your surgical mask. So this is level 1. This level 1 is basically when you are coming for your rounds and you're in the clinical area seeing the patients. So we even need to cover our eyes here. So either you can use goggles or you can use a face shield. I would recommend to use a face shield because face shield is much easier and you are protecting your eyes also. These are the face shields which is available in our hospital. So you can use this face shield. And he's already wearing shoe covers, so you have to wear the shoe covers also. And then he will perform hand hygiene and wear the gloves. So perform hand hygiene and wear your gloves. So that's the last step. So this is the final protection level 1. So now we will move ahead onto the level 2 protection. Level 2 protection is required when you are working in the intensive care unit, or if you are in the quarantine place when you are at the flu corner. So moving ahead. So starting with level 2, first you have to don a impervious layer on top of the gown. This is the third layer which has to be discarded after the use. Either we can use these, or we have got other impervious gowns also which can be used here. I would recommend this because it is very easy to move around in the ward and working, because we don't want it to get much heavy. So proceeding ahead, now you have to use N95 mask because you are in a high alert area, intensive care unit, or in the quarantine place. Then coming to the eye protection, you have to wear the goggles also. And this has to be, after the goggles, it has to be followed by a face shield. If you want, you can use a surgical cap. Otherwise, if you are comfortable with it, it's not like must for it. And then you have to do the hand hygiene followed by donning of gloves. So now you are ready for level 2. Level 2 is for intensive care unit and when you are sitting in the flu corner quarantining the patients. So now we'll move ahead with the level 3. So level 3 is the utmost protection, and it is the time when you are doing aerosol generating procedures. So he will be augmenting this with one impervious gown. So level 3, after you have donned the plastic sheet and you have donned the full sleeve gown and the shoe covers, you will start wearing the cap. So in this you have to take care the skin is not visible. On top of this you will use the balaclava or the visor as it is known as. So this we have made in house. So the basic purpose is your skin should not be visible. After the balaclava or the visor, you have to put the N95 mask and the goggles, both of them. Now level 3 has to be augmented with a third layer of an impervious gown. So make sure this is an impervious gown. So we have 2 or 3 type variety available with us. So as and when the need rises, we will be going to different kinds, because one single particular kind is not available. So we have like mixed, but we have an impervious gown, and this top layer has to be discarded in the end. So after the gown, you have to wear the face shield. Followed by hand hygiene and one more layer of gloves. So basically here you need 2 layers of gloves. So this is level 3. Level 3 is only required when you are going in like aerosol generating procedures like intubation, bronchoscopy or CPR. So this is the final look. So this is the final look of level 3. So now we have seen all the three levels, level 1, level 2 and level 3. I hope this is now it is clear to all of us which has to be what you have to don at what time. Thank you.